Hello, and welcome to Abby Tyler's Healthy Living. My name is Abby Tyler. I'm your host, a family nurse practitioner, a health and wellness blogger, and a community volunteer. In here, we discuss evidence based health information regarding mind, body, and soul with a holistic emphasis. Thanks for joining me on this journey of health and wellness. Please enjoy the show. Hello, hello, hello. Welcome to our Tuesday show. My name is Abby Tyler. I am your host. And how are you guys doing? Hope all is well. Okay. As you can see from the title, 10 ways to avoid back pain. Okay, so my disclaimer is always I'm a provider, but I'm not your provider. So please do not make any changes to your regimen without first checking with your own provider, doctor, and all that. Okay. And also, let me just address the elephant in the room. For those of you, because now I'm reaching a wider audience, for those of you who don't know me personally on my personal page or, know me in real life and all that too, yes, my education is legitimate. Okay. I did go to school for my associate's degree and then I got my bachelor's and I got my master's. Okay. It's all public information. Bucks County Community College, Immaculata University, and Drexel University. So it's legit. I won't be bringing anything to you. Like I put my stuff there, evidence-based information. So, and I don't want to, sit there and I want to be transparent and I don't want to deceive my audience. As a matter of fact, there are a lot of people out there who are even with before all this came out with a lot of money to be made in this business blogging, health blogging, and all people who coming out with health bloggers or life coach and all. But I just want to say that my education is legit. Okay. And for those of you who need to go to school, I did my motivation story, a couple of posts down, read that, and please do things the right way. Okay. With that being said, let the Lord take over. Okay. So this is what we're going to be talking about today. 10 ways to avoid back pain. Okay. So for those of you, most people have back pain and all that, but most importantly, back pain like 4 out of 5. Okay, so let me just go here and read the stats to you. I like to do stats, but most of the time I say people will hear the stats and they just want to they care about what's going on with them. Okay, so all right, 72.3 million people currently suffer from chronic back pain, surpassing a number of Americans who have arthritis, diabetes, or heart disease, according to the large new Harris poll. Okay, so 4 out of 5 people experience back pain will experience some back pain at one time in life. Okay, some of the reasons for a back pain, the pain could be like a persistent dull ache. It can be sudden sharp pain. Some of the causes of back pain, it could be from an accident, car accident, or sports activities, accidental injury. Also, the kind of job that we do. For those of us who work in healthcare, you do a lot of lifting. I mean, my body, my orthopedic integrity is like because all those many years of lifting and lifting and lifting and all. And when I worked as a nurse, it was like primary nursing too. So it was like we were doing a lot of patient care. It was like patient care. It wasn't just like people always think that nurses just sit at a desk and the aides do all the work. That is not the case. Okay, at least where I worked. Alrighty. And even if you work in a nursing home to you pushing the carts, you're doing things, you're turning patients and all that to do treatments and also, and if you do work in the factories or anywhere, anything that you do a lot of lifting. Also, if you work in the office and you do a lot of sitting, and also you do a lot of standing and all that can also lead to back pain. Okay. So as sometimes you suffer from back pain, but minor back pain, of course, if you can control it at home, if you can prevent it and also control it, that's good. Okay, so let's get into it. Okay. There are other reasons too, like I said, sedentary. If you're sedentary, meaning that you don't move around a lot. Sometimes if you're a little bit overweight, and then sometimes people have like other diseases like fibromyalgia, where it's like pain, where it's like unexplained, but it's some nerve pain. Okay, and then there's some other issues too that go on with that. So people have spinal stenosis, where all of that, where your spine kind of narrows down, going down your back. Okay. So let me just go in here and start. Okay. So if you do have back pain, let me just start at first. You do have back pain, okay? When you should call the doctor, all right? You're dealing with back pain and all. When you absolutely, if you have back pain and you ever get to the point where you start, moving your bowels and also urinating on yourself, absolutely go to the emergency room, because if you're not there and it's not addressed right away, you could end up being completely paralyzed. And even some people who do go there and all that too, they don't gain back all their functions back. But if you feel that happening, you say, well, kind of, going myself. It's not like, okay, you had other issues where you were having like bladder leakage and stuff, but you start noticing that you're having, why am I having number one and I'm go number one and number two? Let me just put it real clearly. And you start to absolutely go to the emergency room right away. If you have to call your doctor first, I don't know how your insurance is set up, call, and then he or she will tell you go directly to the emergency room. Okay. If you have sudden back pain too, there's no reason why you should be walking somewhere unless you have back pain over time. But if it just comes suddenly like that, excruciating back pain, go to the emergency room. Pain that persists for more than few days or worse, and this is when you want to call your doctor. Now it's like you're not going to emergency room. You say, wait a second, this is not going away, and it started, and it's waking me up at night. It's affecting me when I go to work. It's slowing me down. Call your doctor. If the pain wakes you up at night, like I said, if you start having fevers, chills, or other signs of infection, you don't want to have anything going on with, meningitis, any kind of brain issues and all. That's especially you want to call. Other symptoms that you can't explain, like, weakness, especially if you start having weakness in your arms and legs, numbness and tingling, call to get checked. Also for men, that also when you start having inability to perform and you're having low back pain, that could be a sign to, again, you want to get that checked. I already said numbness in fingers. And so if that was not happening, not like I say you're having issues where, okay, yeah, they can prescribe you Viagra or something like that. But if you have low back pain and that's going on, you do want to get checked as soon as possible. Okay, so some of the treatment that we do for back pain, you will start with some cream first. They always tell you that, and people have different things like different nationalities or different different ethnicities have different over the counter things they do, and things that are unique to your culture. You can do that. People can you have the NSAIDs, where anti-inflammatories, where it's like ibuprofen and Melexicam and all those other things. Some of them are prescription strength, but you want to be careful. If you find yourself having to take that so many times a day, that can have a really bad effect on your stomach, because it can like tear up your stomach lining, because it has some bleeding where you start when you go to the bathroom to have a bowel movement, you see some blood in your urine, you start having stomach pain, and over time too, that can also affect your kidneys. So if you find yourself taking that more often, you want to bring that to your doctor's attention. If it then it's not normal pain anymore, so you go to your doctor first, and sometimes they can do some physical therapy, or you may have to get some x-rays done when they send you over to the orthopedic doctor. All right, most orthopedic doctor want you to have like first x-ray first, and then they can go from there. If they have to do an MRI and more definitive testing, there's the one that you have to see the specialties and all that too. Okay, and they can send you to the spine surgeon and also send you to pain management too. But that was way off. So before you get that, for people who already have back pain and all, okay, if you have numbness in your toes, I also said numbness in your fingers and toes and all, okay. So we know how, and back pain can hamper your life. Okay, it affects the fact that your family member, you can't go to work. It's one of the leading causes of disability in America and also around the world, according to the World Health Organization. So, and also affects, you can't do certain things with your family. When you're with your partner, you can't do certain things, because if your back is hurting or you got numbness and everything, the last thing you want to do is be intimate, okay, and hanging out with your friends, and it just really takes a toll of your life. So you want to make sure that you try to stay away from that, try to avoid it as much as possible. But there are times you can avoid it because, like I said, from work and other things, okay. So let's get into that. I wanted to get the important things out of the way first. All right. So just remember, if you have any numbness in your back, you start going number one and number two on yourself, absolutely go to emergency room. No if and buts, go to emergency room. Okay. So some of the ways you can avoid back pain, get more exercise. Okay. I've been talking about exercise all along, making sure you're active at least 30 minutes a day, 3 times a week or more. If you can, go to the gym, you can go walking, you can do some stretching, you can do some dancing, anything that's going to keep your body in motion and get your heart rate moving, higher than when you're just doing like regular jogging. So if you do go for a walk and all, make sure that's like brisk walk. And what I've been doing now, sometimes when I don't go to the mall, I do that. When I'm in Planet Fitness, I do my exercise and I just kind of walk in between the aisles. I know people look at me like, you can just get on the treadmill and all that, but I get elliptical and then I do my walking. If you do that a couple of times, that's like a couple of miles right there. So, I've done my own thing. That's my own way of walking when I'm in Planet Fitness now. Okay, so make sure you stretching before and also stretching after too, because you want to make sure you loosen up your muscles and your ligaments. Okay. Number two, watch your weight. I've talked about healthy weight. I'm not, we talked about everything else that goes along with it. It's ideally you should be no more than 10 pounds, your ideal body weight. So making sure I don't do that BMI thing. I'm not married to it. Like I said, we look at more of the things and all that too. But most, your body, you know how you feel like if you gain a couple more pounds and all. Some people cannot exercise in a way where they can lose the weight. And some people are at the way where they have like problems with the thyroid. They have some diabetes and other things, hormonal issues that go on that they can't lose certain weight. They can't just lose the weight because you sort of just eat less and move around more. It's not always possible with everybody else. So speak to your doctor and see the best way that you can make a plan that works best for you. Okay. But making sure you watch your weight and all that. Eat healthy, eat more green leafy vegetables, cut back on the rice. I did my video on the kind of rice you can put your bucket wheat together. You can eat brown rice, wheat bread, and all cut back. Don't eat bread late at night. Don't eat rice late at night. Don't eat rice too many times of the day. And don't eat anything heavy. I'm talking to also for those of you who eat pasta and all that too. It's not just rice. Pasta, mashed potatoes, all those things that are really heavy, don't eat them late at night. Now, that also depends on your work schedule too. So I totally understand that. But do what works for you. Okay. Number three is sleep well. If you're prone to back pain and all that, making sure you're sleeping well. Some people like to sleep on the back and your back curves in the back there. So if you do that, you want to make sure you sleep on your side. Try as much as sleep on your side. Of course, if you snore too, that's also reason to sleep on your side. Get one of those big body pillows. You can look online what the pregnant women use, where because when they're sleeping, the weight of the pregnancy of the belly in order to kind of switch can put the spine in on an alignment. So you want to make sure that you got like a big pillow, or just stuff yourself with little pillows in the way you sleep at the side. You bend your knees, don't just sleep with your legs like completely flat. Some people do that, but bend your knees and try to get yourself to where you're nice and comfortable and sleep side to side, so your back is not hurting. Okay. And sleeping on your back, some people sleep on their stomach. That's not a good idea because again your spine goes like that and it curves and goes like that. So you want don't sleep in your stomach. Usually, like I said, sleep on your side. Okay. And that's how some people sleep, but eventually you're going to find that you're waking up in the morning and you don't feel well rested. Okay. So of course, if you have any other issues that you need to sleep on your stomach, that's a different issue here. Okay. Pay attention to your posture. I was about to say pay attention to your posture. So always you want to make sure when you're sitting up in the chair. I always find myself doing that because I was in a couple of accidents when I was younger when people just, we were just hitting me in the car. Okay, so you want to sit up straight, like Tyra Banks do, top model when she say you want to sit up where your breast is like facing the sun. Okay, and Blanche Devereaux, oh, just heaving bosoms, how she did a little southern stuff. Yes, I watched the Golden Girls. It's one of my favorite shows. So you want to always sit up. When you sit up in the chair, make sure you're sitting there, your back is against the back of the chair. I need to do that because I find myself slouching over, and sit up straight. Always remind yourself when you find yourself doing this, always do that, and do it like how the royal people do it too, or like really high mighty people where they put when they train them, they put the book on top of their head so it keeps their head up, so right away it keeps your shoulder up so you're not slouching. Even when you're standing up, make sure you're not slouching. It's very easy to slouch, but make sure you're sitting up, and remind yourself every time when you find yourself doing that, sit up straight. It keeps the spine in alignment and keep yourself from having back pain. Okay. And when you sit in the chair, if you have to sit in a chair like an office or wherever, make sure you have like a little pillow in the back. Your hand should be able to feel it back there, and just kind of relax yourself and don't sit too long. Some of these things I'm going to combine them, okay? And making sure you like again, you have back support. If you one of those people who stay in the office all day, or you work on a computer and you spend most of the time sitting down, making sure it's like ergonomic chairs and chairs that have like little curvy in the back where you're sitting there nice and comfortable and keeping yourself sitting straight up. Like how you see me straighten up right now, everything, the breast line is like right up here. You want to do that, okay? Alrighty. And so let's go here. Number 6, try not to type on your phone. I do this to talk about this to my son and to the other younger people. When you're on your phone, it's like this. You're going like that. Remember, your back starts all the way from the back. Your spine starts all the way from the back of your neck there. That's your cervical spine. The one in the right below that's the thoracic spine. In the middle is lumbar, and the back and the bottom one is this sacral spine. So you want to make sure that for younger kids who, and most of us who grew up on the phone now, it's like they do like that all day, and they're doing this and doing that. And it's like Get off the phone and don't sit there. Don't write long dictation and all this, whole dissertation on the phone. Don't do that. Try as much not to be on the phone like this all the time. Lift your head up every once in a while. All right. And you save your long conversations for the computer, or when you're sitting down on the phone, do like that. Have the phone like that in front of you where your neck is not bent over like that. Because over time, even though you may be in your 20s and 30s right now, you think that may not be a problem. But as you get older, that's going to cause a problem, because in addition to the fact that you're doing that, it depends on the kind of job you're going to be doing. All of that over time can take a toll on your back, okay? Upper back and lower back too. So try not to do that. Stay off the phone like that, okay? And let me see here. Take lots of breaks. If you're sitting down, if you're one of those people who sit down, like I said, you want to get up at like every 10 minutes or so, even like an hour. Because I used to have my iPhone, my iWatch, it had this stuff to say, okay, time to sit down or time to stand up. So you get up, stand up, stretch, move around in the wherever it is. You have to walk around for a little bit until you stand up for one whole minute. If you're going for long flights, if you go in somewhere where you find yourself sitting there for most of the time, try to get up and move around, stretch every time, at least every hour. Okay, sitting down, it says sitting, a new phrase, sitting is the new smoking. So plus if you sit down for a long period of time, you're going to have some swelling in your legs, because all that blood's going to pool into your legs. And then if that pools into your leg and it clots up, you can, that breaks away, it could travel all the way up to your lungs or travel to your heart and all that too, and you can like literally die from a blood clot, okay, or travel up to your brain. So you want to get up as much as possible. For those of you who travel, like especially back and forth for work, and those of you going back home to different countries and all, if that flight is long, try to get up. Even if you're on the train or whatever, try to get up at least an hour and shake your legs. And when you're sitting there, if you cannot stand up and move around, you can still get up and move your legs around. Try also watch the kind of shoes that you're wearing too, so it's not shifting your weight. Okay. If you can smoke, of course, all of that, you don't want to stop that. Okay. Do a lot of stretching when you wake up in the morning. Get up, even if you don't exercise right away. You get up in the morning and you stretch. You put your arms out and stretch, bend over, stretch, open, loosen up all your muscles and everything. And of course, like I said, if you're going to exercise, stretch first. And if you're done, when you're done, stretch, making sure you're drinking lots and lots of fluids, unless if you have heart issues. Okay. And let me see here. Be careful how you lift, especially for those of us who are working places where I don't do that much lifting anymore. Thank God, because my body is old. Okay, so if you're bending, you know that if you work in a hospital setting or anywhere that you do lifting in a factory or wherever, even if you're lifting up somebody, you're helping your family member at home or doing something with younger kids or doing anything else, you want to always want to bend down. You want to bend down where your knees are bending and then lift. Don't just reach over and bend your knees and then lift. And when you're turning, watch how you're twisting back and forth and all that. So if you're going to lift something from here, make sure wherever you're lifting it to is close by. Don't go swinging from one place to the next like that. And so, especially for those of you who work in places where like almost like a factory line where you're moving things over, be careful how you swinging back and forth, okay? Because all of that can have an effect on your back later on. So do as much as you can. Bend with your knees. Remember that, bend with your knees, okay? And again, don't go, if you have to push anything, push instead of pulling. Make sure you're pushing. If you can drag that box, if you can push that box across the floor, even though it's going to annoy people, go ahead and do that. Don't stop pushing and pulling things, because that's going to cause a problem too. For those being construction work and things where you have to stretch and bending over and all, take time, watch your body. It may seem, okay, yes, I need to do this because I need to get my work done and I need to do that and all. Eventually, I see a lot of people who come to me with back pain and all that. And sometimes, as you get older and you're still doing this job, because most of the time, if you're doing certain kind of jobs, you're doing it until you're at least in your 50s or 60s. Okay. And but there are times where you may not be able to do that job anymore when you're even in your 30s, because you have caused other problems that cause you to have severe back pain that limits your ability to do your daily work and also to do your work that you work for a living. So it's important. All right. It's very important. And the other one, avoid high heels. For those of you who can do the high heels and those long spiky ones, more power to you. If you can do that, that's fine with you, okay? But the thing about it is, like, if you're wearing very high heels, and especially as you're getting older too, your body's ability to like kind of, that center of gravity kind of shifts a little bit. And you know how, like, when they say when you get up, when you remember I was younger, I used to be able to do the Tootsie Roll and do all that. Well, some people can still do that. It's nothing wrong with that, but as you get older, naturally your body, take a toll, age takes a toll on you. The body that you've been using for 40, 50 years, and also like dancers and athletes and all of that, even the ones who are very active all through, it takes a toll after a while. So you want to do as much as you can to work with the body because you only have one body. Okay. So it shifts your center of gravity. So if you can wear high heels, go ahead and wear it. If you're not safe with it because you don't want to fall, first of all, you don't want to fall and hit your head and have a head injury. And also you don't want to break anything, because the older you are, if you break something, it takes a longer time to heal. Okay. I'm not saying anything against you old people. I'm also old. All right. So making sure that if you can wear it and take the nice pictures, you notice how most women now, they have the nice little high heels on. They take the pictures and then they have the nice little low heels or slippers at the end of the night, because you got to be careful. Okay. Because you have to go to work. You can't be sitting there calling out from work because your body hurts. And don't do it. If you can tolerate it, I say go ahead. Strut your stuff, do your thing, look all sexy and all. It works for some people, not for me. Okay. I've been all those many years of nursing. I can't wear high heels too long. All right. And let me see also. Then it has some very nice high heels though, where they have like the cushion and all that too. So if you want to do that, go ahead and do it. Not say anything before people start saying I told them not to wear high heels. All right. And also it said stashed the skinny jeans, because some men, they had like these really tight pants and all that too. And anything that, or women, or with the tight pants, tight jeans, anything that restricts your ability to be able to bend over, twist and turn and sit comfortably and walk comfortably, that can also cause problem with your back. Okay, so try not to wear something that's so uncomfortable, that's so tight that you find yourself where your fingers can go through, and you're sitting there and you have to be moving this way, moving that. Maybe sexy, may look good if you're like, okay, I see you, but is it worth it? Okay, so make sure you take your time and do that. And also, if you have any problems with your legs and all, make sure that you go in to get checked. If you have to go to go see, there's no disalignment, there's no alignment in your hips area, or you had any problems with any surgery in legs before that caused a shift in your balance, make sure you get that checked, because it could be nothing else going on your back. It could be that. Okay, and the kind of shoes you wear into, not just say high heel shoes. If you working on your feet all the time and you're standing in your feet all the time, try to get really comfortable shoes. Okay, that have you standing up the right way and providing lots and lots of cushion if you have to stand up. And of course, when you're standing up for a long time, try to shift back and forth so you get that circulation going back and forth. Right, you're not just standing there and having your blood pooling at at your feet. Okay. So basically, it's not totally comprehensive. There's so many other ways to avoid back pain. But the most important thing, if you do have back pain and you're supposed to be taking medication, take it the way you're supposed to take it. And like I said before, the things that you want to absolutely call for help. If you find yourself having incontinence, meaning that if you having accidents and you're having number one and number two, having a bowel movement and urinating yourself, if you're having a hard time performing and because you have low back pain and things like that, those are all the reasons why you don't want that. It's called saddle anesthesia or corticosteroids, where you're sitting there and you're having like numbness, and that can lead to paralysis. Okay, so it's important that you do call. It's important. Numbness and tingling in your hands, and or if you're in an accident or whatever, if you had back pain before that, always good to call. All right. If you're sitting up, make sure you're sitting up. You're not slouching. Make sure you're eating healthy as always. Like I said, you want to be healthy. So if anything should happen, you have enough, defense to go up against anything. All right. Stay as active as possible. Do your dancing. Watch your stress level, of course, and do the best you can. All right. If you can exercise, talk with your doctor and try to come up with a plan that's going to keep you healthy. Alrighty. So I don't like to make these things longer than 30 minutes. But so if you like this show, please give me a thumbs up. Please like and share. Please like and share. Like I said, if you like and share it and you share the show, somebody else who may relate to this can also follow through. Okay. Because if you like and share, and then it sends the algorithm sends it to other people that wouldn't have otherwise seen it, and people learn from it. I learn other things when I see other people sharing things, and I learn it from there. Okay, so thank you all for watching. I mean, just see here. I can't believe I did this entire show without my glasses on. Of course, I have this and of course, wear your glasses if you're supposed to. Now this one is kind of tiny, so let me just check here and see. And then I will leave you guys so you can go enjoy your night. Oh, wow. Okay. Alrighty, let me see. Emmanuel Jackson watching from Boston. Hi, Emmanuel. Thanks for watching. Oh, hi, Watson. Thank you. And darling, what will shoulder and neck pain? Yep, that's all part of your back, because if you're having any pain in your neck over here, all these muscles over here, all of that just transfers all over there too. So if you are having those things, you want to make sure you talk to your doctor about it so you can start whatever medication or therapy that I want you to do. Okay. Glendy Genius. Oh, hi Glenn. Thank you. Thanks for watching. And oh, goodness, hi, it's very important. Thanks for watching. And working from home and sitting too long is the culprit. Thank goodness for staying. Yes, yes, it's always good to have those days. I have where I don't sit as that often. I don't move around as often as I did when I was a nurse, but working now too because I'm back and forth in my office and back and forth in the patient examination room. So I have one of those high decks too because when you're looking down too, that kind of hurts your neck when you're looking down like that all the time. So I have an elevated desk where I have the laptop right on top there where I can just go in the room, see that, and do that because my eyes just narrow down like that. That was not safe. Okay. So I got it. Alrighty, Smido, great show. Thank you. Thank you all so much for watching. I really appreciate it. Hi, Eugenia. You're late. That's okay. You can still go back and watch the rest of it too, okay? And watching the Hickory, North Carolina, Smith. Okay. Alrighty, North Carolina in the house. Eddie Marilyn, Emmanuel Jackson, long time. You see me all the time when you say that. Thank you all so much for watching. I appreciate it. Let me just go in here and see I'm not missing anybody. Oh, Missy Dopo. Hello. How are you, Mr. Global Analyst? Hope you guys are staying active there. So, alrighty. So, but thank you all so much for watching. Please share the show. Give me a thumbs up, please. Okay. So that way people say, oh, okay, what she's saying is important. And I wish you all the best of luck. Share the show, and I'm always on here Tuesday at 7 o'clock p.m. Eastern every Tuesday. If you guys want any topic that is within my scope of practice, just let me know. You can always send me an inbox, or those of you know me, might have personal thing, and also you can send me an inbox through Abby Tyler's Healthy Living. Okay. Make sure you exercise. And look, I'm talking to you guys and I'm slouching over. Let me sit up straight. Okay. So you're supposed to be sitting up straight like that. So let me see. I don't think I have any more. So Willard Freeman, good advice. Yes, yes, it is good. It is good. And I missed the beginning. Oh, you can go back and watch it. I put the show on, it stays on, and go back and watch all the other shows and all that too. I put in really good shows. All right. So thank you all so very much for watching. I really appreciate it. I appreciate you all for those of you who will be watching later. And also I can always answer questions later on to people who comment, those who can watch because not everybody can watch at the same time. So I usually comment later on and all that. And Jackie Jackson, good eating habits helps. Yes, like I said, as long as you're eating healthy and drinking a lot of fluids, eating, because you want to, that all part of like watching your weight, eating healthy and all that. So it's very, very important. You always want to make sure that you stay healthy and staying strong. I'm slouching. I'm slouching because I'm reading over. Okay. So let me lead by example. So he sit up right straight, just like that. Okay. Like the breast is facing the sun. Okay, so thank you all for watching so much. I really appreciate it. And for those of you be watching Focus on Liberia, I'm going to be in the other show at 8 o'clock. Okay, and those of you watching from YouTube, thank you so much. And those of you who haven't liked and follow Abby Tyler's Healthy Living page, please like and follow. And I do my daily shows, Abby's Daily Dose, at least once 2 to 3 times a week. Okay, so thank you, love you all. Thank you all for watching, and I will talk to you guys later. Okay. Bye bye.